My name is S.
I think we've lost Esseza for a minute. Hoping she'll join right back. But yes, my name is Jean-Pierre. I am a warrior from Zambia. I'm also like a digital marketing expert. And I host a podcast called Pain Free, where I also share my story with sickle cell. So I'm going to be one of the moderators tonight with Esseza, and we're looking forward to a great discussion. We're looking forward to growth and understanding our different journeys, even though we have like the same, we're afflicted by the same disorder, but we would like to just find out, especially concerning with men's health and how men have dealt with this disorder from different backgrounds, different nations, different traditions, and just also people's different understandings of this disorder. Because in my own experience with sickle cell, it's been quite a lot because people don't really understand the disease itself, and trying to explain to people has really been difficult because the perceptions of what it is, treatment, and so it's just been quite a lot. And so tonight we'll be diving deep into how warriors have been dealing with it, especially the men. And we're so excited for the panel that we have tonight. We're looking forward to the questions and just understanding and being impacted on our journeys, on our individual journeys, but also on this journey as warriors. So let me just check in if Esseza is back in. Esseza, can you hear us? Can you hear me?
I can hear you. Can you hear me?
Yes, I can.
Okay. I'll be keeping my video off. I think that will help with the connection.
Okay.
So I don't know if my introduction came through earlier, but I'm Esseza Kironde Hall. I am a sickle cell warrior, and I'm excited for this webinar today with Men's Health. I'll be representing Sickle Cell South Africa.
Amazing, amazing. So if this is your first time joining this webinar, we'd just like to welcome you, and we're grateful for you to being here. We have a great panel of speakers who are going to share their wisdom with us. So in just a second, we'll begin with our first speaker, but these are the speakers that we have tonight. We have Dr. Modubela Jalal. I hope I pronounced it right. Please do correct me if I didn't. We also have Aliu Badara Sambu. Hope I'm getting it right. We have Grajevis Mbakatukanda, or Greg for short. We have Peter Joseph Osikikoya. And then we also have Jimmy Stefan Anderson. Just let me know if everyone is in, and then we will begin with our first speaker. Our first speaker is Dr. Modubela Jalal. You can just send a thumbs up in the chat so that we can, I'll be sure to know that you're ready to go. Just in a few. Okay, so our first speaker is Dr. Modubela Jalal, and he is a Gambian medical doctor with 7 years experience and has dedicated his career to improving the health and well-being of people in his home country. He works as a research clinician at the Medical Research Council in the Gambia. Dr. Jalal trained in the Gambia. He's the current president of the Association of Residents Doctor. He also doubles as the country director for Your Change for a Chance, a nonprofit organization that works to empower young people in the Gambia through education, training, and community services. In addition, he is an executive board member of the Sickle Cell Association of the Gambia, where he advocates for the rights of the people with sickle cell disease and promotes awareness in the disease across the country. Dr. Jalal's passion for hematology led him to pursue a master's degree in hematology at the University of Chester in the United Kingdom. He was awarded the prestigious Chevening Scholarship in 2019. Upon completion of his studies, he returned to the Gambia and has been working at the Cuban hematologist caring for patients with hematological problems, especially sickle cell, until he joined the MRC last year. As the president of the GOD, Dr. Jalal is committed to advocating for the rights of doctors in training and improving the quality of medical education in the Gambia. He has been actively involved in several initiatives aimed at improving healthcare delivery in the country. Throughout his career, Dr. Jalal has demonstrated exceptional leadership skills and a deep commitment to serving his community. He has been recognized for his outstanding work by several organizations, including the Ministry of Health and Social Welfare of the Gambia. Dr. Jalal's dedication to improving healthcare in the Gambia and empowering young people through education and training is an inspiration to many. He continues to work tirelessly towards his goal of becoming a hematologist and making a positive impact on the lives of people in his home country. Dr. Jalal, we are so privileged to have you with us tonight. We salute you and all the work that you are doing, and we're looking forward to hearing what you have to share with us in the next few minutes. So whenever you're ready, you can begin.
Good afternoon, good evening from wherever you are joining us. Thank you very much, John Pierre, for that wonderful intro. Thank you, Eseza. I hope I'm pronouncing it right, and everyone listening and watching us. Just to begin with the talk. Now, sickle cell anemia and men's health is one area. When Aliu told me about the topic, I was like, this is one area that we've not been focusing on. And as you just introduced, these are areas that we should be talking about, because sickle cell, if we don't discuss about it, it becomes a challenge. And I believe with advocacy and also implementing more policies would help us with regards to how do we better care for people in general suffering with sickle cell, especially now males or female. So the outline of my discussion would be just a brief intro about the condition, and then I will concentrate on the sickle cell associated problems when it comes to men's health, and also with regards to the treatment associated, and also the mental health aspect of it, with also concluding with few recommendations. Go to next. Now, just a brief intro. When we say sickle cell, usually people just think that this is the disease of the bone, because of the most common presentation is bone pain. But actually, the disease actually affects the blood, and the part of the blood that is affected is the hemoglobin. And this is as a result of a substitution with one of the bases, which is the glutamic acid, to the valine in position 6 of the beta chain. Now, the disease is very widespread, but the fact that we don't screen, so we don't get to know as the actual epidemiology of the disease is not well known, because most of our times it's only when a child is born with the condition, then we will now do tracing back, which is to now screen the male and the parents. So now looking at the numbers that we have, it is inherited recessively. When we say inherited recessively, means you can only get the disease when you inherit it from both parents. You can get part copy, which is the trait, which is not the one that we are discussing. Usually, some of those people don't have the condition, or they don't suffer from these complications. But now, when you receive the gene from both parents, that's from the mother and the father, then you become SS. And now, out of these children that are born yearly, the statistic we have is about 300,000 per year. But when you look at the demography, most of them, about 90% of them, are within sub-Saharan Africa. So which carries the highest burden of the number of sickle cell cases. counted. Now, the other thing about these numbers is if 300,000 is a high number, that is just the counted one. Imagine an Africa where the statistic, the studies are usually always, the numbers are always below the actual thing that is out there, because not everyone is in a health system, so it means that these are the numbers we could use to explain, but we have far more numbers out there. And the worst form is when you receive both genes, and it is associated with reduced survival, especially under 5 children. Next. Now, when it comes to the disease presentation, usually whether male or female, these are the organs that would be affected. Because it's a disease of the blood, it could affect every organ of the body, regardless of which one, whether you are male or female. Now, this is a pictorial representation of what could possibly be affected, depending on where the vaso-occlusion happen, whether there is also continuous hemolysis, because it will either lead into a very chronic condition, which is the chronic complication, or just an acute condition. Like when there's a blockage in the blood vessels in the head, the individual will get a stroke, and then from that on, the life of the individual will change. Now that we are focusing on only male, so you realize that priapism is one of the conditions that could be affected. Next. Now, the first group, which is the sickle cell associated problems when it comes to male health. Now, I'll put pain on top. Pain. When it comes to male, management of pain is usually underestimated. Even in general, sickle cell patients are usually underestimated when they say their pain is 10 on 10. For some reason, some people will start, saying, probably the individual is exaggerating pain, especially if you are given high, analgesics like the opioids. Within a short time, the thing will wean off, and then you will now start screaming again. So imagine a young man or a strong, able-bodied man crying. So that just tells you what level of pain threshold would that individual be going to be able to cry like a young baby. So this is one of the challenges that men or boys, young boys face when they present to hospital, or when they even tell their parents that they are in pain. The way they are experiencing, feeling the pain, and the way that people respond to that pain is usually very different. So as a result, when you need care immediately, because of that perception, they tend to underestimate it, and then they will not take you to hospital to seek treatment. Now, the other aspect of it, which is also very sensitive, which is the priapism. We know vaso-occlusion is the most common presentation. Usually is the bone pain. But now this occlusion of the vessels, that is blockage of the blood vessel when the cells get sickled, can affect any part of the body. So certainly the male genitalia is one. So when it blocks the penis, let's say somebody just get erection, because what causes erection is basically the blood filling those tissues and then getting hard. But now when that blood is not able to get withdrawn, so you have this sustained erection, which is undesirable. So but how many people can just come to somebody and say, hey, look at my genitalia, it's erected, and it's not something that is going down for the past 2 hours, 3 hours, 4 hours, so it becomes an area of which is very sensitive. And in our African setting, reproductive issues is something that we don't even talk about, let alone to discuss and then be showing and being feeling very comfortable about it. So this is one area that we need to be improved when it's up to men's health, because this, when it's not treated urgently within the next when there is erection for 4 to 6 hours, it needs immediate attention. If it's short time, it could be managed, because some of them will just resolve spontaneously. But how many of those who resolve spontaneously are not reported? This is why the true rate of this condition is not known. And usually, how many boys, 12-year-old, 13-year-old, 15, 18-year-old, will go and face their parents and be like, Mom, have a look, I'm having a sustained erection. This is something that is not, it may be done by only a very small number of people. So you realize that at the end of the day, this could lead to some other complications at the end of the day, while like getting erectile dysfunction at the long run. So the other challenge when it comes to also boys is that you see your mates growing. For some reason, retarded growth is something that is very common. Now, by the time young boys reach 13, 14, they start seeing signs of poverty and all those things. But now as a sickle cell patient, you tend to have this thing delayed. You know, instead of starting to see your semen at the age of 13, 14, 15, you probably can go up to 17, 18, 19, or even 20 before you start having all these symptoms or all this happening. So, and this kind of also affects some people, because when you see them, they are very small for their age. You can see somebody looking like a 10-year-old, only to ask them what is their age, they'll be like, I'm 18-year-old. So you start to be like, is that true? You know, so all this is another challenge that young boys and men have. So the other issue is also infertility, which is one area that, you know, by default, whenever you mention infertility, the first thing that pops up is probably when people are married, there is challenges having children. The first culprit is the woman. So, but in actual sense, there are male infertility is something that is in existence. So, but our society makes it so rare or so strange that a male cannot be infertile. The moment somebody gets married and they are not able to have children, the next thing is that get another wife, get another wife. You just keep on adding, you know, the number of wives, yet still you are not having children. And some could even say, okay, what if something happened and one of the women went outside and just gets you a baby, and then that problem you will never know what was the actual cause. You know, then they will be like, it is this woman and the other woman was able to bring a child. And some of the reasons for this is because of the condition itself. So there is usually testicular hypoxia, lack of oxygen going to the testis, and as a result, the testis will not be very active. Testosterone level will be low, causing all this spermatogenesis being delayed or even affected. Now, to move to the treatment associated, next. Now, when it comes to the treatment associated, now hydroxyurea is the drug which is most readily available when it comes to the treatment of sickle cell for many years now. Now, one of the challenges we are facing is that one of the side effects found in some studies are that it causes low sperm count. And the moment you mention some of these side effects, sometimes to participants who you are trying to enroll to it, because of this, they may take the medication, but if they go home, they will not be taking them. And then you will be treating them with hydroxyurea, yet realizing that, you know, they continue to have crisis. And, you know, whenever you ask them, they will tell you yes. So, but this is the main issue. This thing is reversible. So when you are giving them the hydroxyurea, the benefits of the hydroxyurea is far more greater. When you have less crisis, your organs will not be damaged. So the issue of all this hypoxia of the testis and the like may not likely happen, or may not be as worse as somebody who is not on treatment. So in this case, we should be telling, as doctors, we should be telling the patients that, you know, taking these things in the long run is going to, because sickle cell, the fewer crises you have, the more stable life you have, and the more the better these organs are safe. So this is one area that we always encourage people that are dispensing hydroxyurea to men or to young boys that are taking the medication, so that they will be compliant to have the benefit. Now, the other aspect, which is also treatment associated, some people will present to the hospital, but now aspiration is done or something. Now you realize after some time, they will now call you back to say, you know, they're having erectile dysfunction as a result of that procedure being done. And it's only few of them that will actually, you know, feel come back and tell you how much of this impact have done to with their mental health, their life, their confidence, and everything. So when we do some of these procedures, it's usually life-saving because it must have reached at the last end. But usually when this erectile dysfunction happen and you ask these people to, take long-term medication so that they will be doing exercise to see how best they've already concluded that, okay, I'm not a man. And then when you tell it to your friends, probably they will now, make joke out of it. For some reason, people just keep it to themselves, and that's how their life end up. Next. So because of this, there are associated mental health issues in men, which we always tend to overlook. So now the disease itself is a chronic lifelong disease, as in other places. In Gambia, most of the time they use this term as under doctor patient. They say this one will get sick here and there is always sick, so he's under doctor. These derogatory terms, using them in people having sickle cell will, affect their confidence, and then you see they have this mood swing, depression, their self-esteem is very low. Their confidence in life itself is very poor. So with knowledge and telling them how to best empower themselves, all these things could be helped. Because if you look at the stories of warriors, you give hope to yourself that, okay, if this one can make it, I'm a good example. If I say I could make it, what is there to prevent me from making it? So all these things are things that we should be putting in our young boys, telling them that, okay, Modu is here, he's a doctor, and he went through all these things, trained as a doctor, did hematology, and now he's giving back to people of, like him. Imagine if we have 3-4 hematologists in this country. If I'm treating anyone, I know both sides of the story. I know the story as a patient. I also know the story as being a doctor. So no patient will come to me saying that I'm in sickle cell crisis pain and I tend to underrate it, because I know how it feels to be in pain. So, and the other mental health part of it is the challenge of finding love. We know as men, as human beings, we are social beings, and the issue of confidence will just affect your mood, and then you just be thinking that it is very difficult to find love. By the time you start talking to one lady, or then you realize that, okay, you want to know whether you are compatible, and this become one issue. The moment you raise the issue that you are a sickle cell patient, some of them will just say, I think I cannot go ahead with this. And you have that fear of rejection. For that reason, you just, don't want to try your luck again. And then you become that isolated individual with no love and, the challenges. Now, the last part is also the stigma and discrimination. When you are moving with your peers, let's say I'm the only one with sickle cell and my peers are, having boyfriends, girlfriends, I want to fit in because of that peer pressure. I want to also be the G, to be saying that I'm in the same level with them. For that reason, I'll be doing things that may not even go in line with my health. Let's say if my friends are people that are doing athleticism, very sporty, and I want to go to do marathon. That is something that I will start, probably I will do, but at the end of the day, I will be ending up in the hospital. These are things that, we should educate the young boys, young men that are growing up to know, as my condition doesn't allow me to do some strenuous activity which will compromise my health. So why not invest in, some other areas that I could productive, career music. There are many careers there that you could do without having to do things that will, cause you to be having many issues with your life. And the last part is the disability part of it. Let's say somebody gets stroke, or have, a vascular necrosis of the head of the femur. They have these mobility challenges and they become a big problem to the family. If you were the son that they were looking for to, providing with the family, and then you just suffer from this stroke, or you have AVN of the femur, you are no longer able to go to work, and this will not only impact you as an individual, but it will seep out to the rest of the family and all the challenge. Next. So to now conclude, just few recommendations that I think what we are doing around awareness creation and advocacy is the only way forward, because if people don't know about the condition, they will think they are safe from it. And sickle cell, as long as you don't get tested, you cannot say whether you are free from the disease. So, and this is the only way we can push so that policies will come in place. And specialized health program, for this one, the government should be leading in all the countries, especially African countries, where the burden of the disease is most common. Because by the time you do early detection, and diagnose people early, you start treatment, the risk of complications are very minimal. And having safe space, like what we are doing, this is a virtual safe space, but it should also have, within countries, we should have huge space. Imagine me going to an elderly doctor telling him that I'm suffering from this. So let's say I'm a youth man, I'm a doctor. We have a space that, youth come together. I go there and, have counseling and this talking. And, because we are the same age mate, there is that confidence that, okay, he's just like me. And then they will tell you what they're feeling. And you as a youth, you will understand. But if there's different in generation, let's say third generation and the younger ones, right now, there will be that gap, and there will be conflict of understanding each other at sometimes. Now, when it comes to family and community support, the religious leaders, interfamily marriage, all these things are things that if we educate them, they will avoid. Because if one thing that is very common in Africa, or in my country here, for example, interfamily marriage, the uncle's son will marry the nephew's son. Let's say me and my younger brother, my daughter will be married off to my younger brother, daughter. Before the genes within the family, it keeps increasing. They were great, but now they are giving birth to children that are, having sickle cell. And the religious leaders usually also don't understand about this condition. It becomes a challenge when a man is having issues with his fertility issues and goes to the imam only to mention, okay, erectile dysfunction. Many people may not even understand what was the cause of that thing. So the religious leaders also need to be educated so that they will ask, have you been screened? Are you compatible? Are you AA? Are you AS? All these things are things that we could do to improve. And the last bit is local and international partnership. We know there is one available treatment, which is the stem cell transplant. But when you look at the centers that these things are done, most of them are in abroad. Why not Africa, where the burden of the disease is very common? We should be having this local and international partnership where we should be providing for the severe people that may need these services. And we give them chance to life, because the success rate of this stem cell is 90%. When I was doing my thesis for my master's, that was the thing I did. And I was shocked to see that the success rate was 90%, only 10% was the failure. So it means that if you do it for every 100 patients you treat, it's only 10 of them that will be, will need some other things, but the 90 will be free of the disease. So these are things that we also recommend. I think I will stop here. Thank you very much for having me. And I'm looking forward to the questions and discussion. Thank you very much.
Thank you so much, Dr. Modu. Certainly for me, you kind of like took me back into my own childhood and growing up and dealing with all these situations. I remember I only hit puberty like in my second year of university. I was like the tiniest in class, and I didn't have this information back then. I didn't have this community to understand what was happening to me. And I certainly believe if I had access to such platforms, if I had access to such knowledge and understanding, obviously I would have dealt with certain things differently on a mental level. So thank you so much for sharing that. Thank you so much for helping me understand what I went through. Hopefully I can help, the future generation coming up by creating a safe space, by educating them about what's going on, with their bodies. We're still taking questions. Please type all your questions in the Q&A, and we'll have a portion where the doctor will come in and answer the questions. So I think we can move on to our next speaker. Let me just check in if Eseza is able, if she's in. Hi, Eseza, are you in?
Yeah.
Okay.
Yes, I'm here.
All right.
Go
ahead.
No, it's Aliu. Ali is going to be our next speaker. Jean-Pierre, could you please introduce him? I don't have his bio on hand.
Okay. All right. So our next speaker is Aliu Badara Sambo. I hope I pronounced it right. You'll let me know how to pronounce it. So he's a social activist and sickle cell advocate. Aliu is a sickle cell warrior with SS genotype who doubles up to be the president of the Gambia Sickle Cell Association and also serving as the interim vice president for Umoja Africa Sickle Cell Consortia, whose aim is to unify all African sickle cell associations and organizations in order to speak with unison and oneness for all living with sickle cell and their caregivers. His role as an activist started way back from primary school when he was elected as president of the Red Cross. From there on, he became involved in so many youth groups at school and in his community. His passion for speaking to the less privileged and the vulnerable became more clearer when he started singing and later took up the role as the president of the Gambia Sickle Cell Association. He's a certificate holder in business and marketing, a high school graduate from St. Augustine Senior Secondary with 15 years working experience from different walks of life, and currently serving as the director of academics for Gaya Njoro Schools Academy, a TVET institution. Ladies and gentlemen, please welcome Aliu Badara Sambo. Mr. Aliu, we are so grateful that you are here with us, and we're looking forward to hearing what you have to share with us. Whenever you are ready, you can jump in.
Thank you very much, Jean-Pierre, and good day, everyone. It's afternoon here, but good day to everybody. I hope I am laudable, and I hope everybody is hearing me loud and clear.
Loud and clear.
Thank you. And thank you for that wonderful introduction. Thank you, Dr. Bella. You have just said everything that we were supposed to say, and then I'm glad that you brought in those presentations and slides. First and foremost, I will just want to start from fear. I guess, Doctor, you mentioned that the challenges that we face, and then some of the reasons why as men we face so many complications is because of lack of having the platforms to discuss or to talk about some of the things that happens to us. And then I guess this is one of which have not been done. Maybe it's not that popular. So talking about men's health in sickle cell, it's very important, and this is timely and well needed. So I will just start by saying fear. Bella, you mentioned that. I think the fear of rejection, the fear of being called names, this is one of the most one of the biggest challenges that we face as men. Not having the platforms to discuss about our physical changes and some of the things that happens during puberty, it's a great concern. If as we grow as young men, and not having the right platforms and the different social backgrounds and the beliefs that we have within our communities makes it so difficult for men or boys, to have access to the right medications or the right treatments of some complications that are caused by sickle cell anemia. So the fear of expressing oneself it's a big challenge. This is a big challenge, which I believe will lead to so many problems with sickle cell health for men. So if we cannot break this thing, then it will become a big problem for us. And as young men, it's always difficult to express ourselves because there is this fear of rejection too. You want to be a man, like I said, if you are growing up, and then if you start seeing changes in your body, and then you're working with your mates, and then there are certain things that they disclose about which you don't have experience, especially for sickle cell boys. We have different stages. We have a gap when it comes to maturity. There's this maturity gap between young boys, with sickle cell. So sometimes I could just take an example from myself when I was growing up. There are certain things that people used to experience and talk about. If you are in their midst and you are in the same age, when they start talking about this, you start wondering if you are a man or not. These things, cause a lot of mental issues. And then for me personally, I believe sickle cell, mental trauma can also increase sickle cell problems. So it was very difficult for me to understand, but actually as time goes on, because I was patient enough, and I was also doing a lot of research, asking, going online, reading more about sickle cell. But as time goes on, I started to realize that yes, these people were talking about this, and now I am getting used to it. Now these things are happening with me too. So it's really challenging. It's really challenging as a young man growing, because as far as we have different growing schemes, like experiences, because of our condition. So it's always difficult. It's always challenging. But once you know how to break this fear, but if you don't have anybody to talk to, it's always difficult also. So I believe having such platforms and creating such awareness will help a lot of people. We are fortunate to have such, and then I believe with such platforms we'll be able to teach a lot of people, and then help a lot of people, because it's always difficult. And then there is also another point that you mentioned, finding love. It's also something very difficult with young men with sickle cell, and this all will go back to mental trauma, which also discourages a lot of people. Like you said, there are some people, when they have sickle cell, and then with all the misconceptions that people believe, and the discrimination, sometimes you end up giving up, whilst not even having the chance to go and try. It's also difficult. I believe men with sickle cell, or boys with sickle cell, have to be coached, and then have to be trained to understand, about this issues. So it's always difficult, but the stigma and the discrimination and the misconception, these are also issues that really affect young boys as they grow. And then these are things that we need to sensitize more, as we have a lifelong chronic disease that disturbs us. So it's always challenging. I know it's very difficult, because as a man, we sometimes we feel too proud to even talk about some of the issues that we go through as warriors. So and then our societies also don't allow us to express ourselves, or we feel fear, or we are not given the chance, or people don't listen to us. So these are all challenges that we face as young men growing up. So there are lots of challenges. There are a lot of health challenges, or health issues with regards to men with sickle cell, especially mentally. Mentally, we have lots of challenges, because from the onset, we have already been discriminated, and there are lots of misconceptions within our society. So this caused a lot of challenges. It also pushed us to fear to even go and ask, or even make research, or tell people about how about the things that we feel or as young men. So it's not easy. It's very hard, but you have to be very bold, and then you have to do a lot of research. We have to break the barrier of fear. We also have to break the barrier of keeping silence, because these are some of the things that causes lots of harm. Imagine someone having priapism, and then you don't have anybody to talk to until that issue prolongs, and then it becomes something that you cannot cure anymore. It makes life very difficult. And then, as you said, as warriors, the less crisis, the healthy life we have. But if you have some challenges of speaking out, if you have challenges of speaking out, if you have a problem of discussing about your mental issues, your health issues with anybody in your family or in your society, then it makes it a problem. It prolongs. Anything that you observe with yourself makes it makes it very hard for you to discuss. It makes it very hard. As far as you don't discuss your problems, then it will be very difficult to cure. I always tell people, if you don't discuss about your health issues, then you will not find the cure, the right cure to it, because it is only when you discuss about it, it is only when you tell people how you feel it, then that is when you will be able to get the real guidance or the real cure to your problems. But it's always difficult because our societies don't accept people talking about their private lives. It's also not normal for just a young guy to go and talk to anybody about their private life. So this barriers makes it very difficult. And then if we don't find a solution to this, then it will keep on growing. And then we concentrate more on other issues, like you said. People think sickle cell is just about bone issues. Yes, that is where we have the pain. Some people also think it's just about anemia. It's not just about anemia. There are a lot of sickle cell health issues, both in both men and women. So if we think it's only about having pain in our joints or anemia, and forgetting that there are other complications, then when are we going to solve this problem? So I believe we have to set up this kind of platforms. We also have to set up social groups whereby sickle cell warriors will come out, and then we'll have the platform to come and speak. And then we also have lots of people like Bella. If we can have more sickle cell warriors getting into this medical field, becoming hematologists, they will give more motivation to the young ones. Like I am right now. When I was young, I never thought that I would go this far. It was always difficult because anytime I tried something, I was just discouraged because people never thought I would live long. So it was a very, very, very difficult problem. It was a very, 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 very hard challenge for me to overcome. But as time goes on, I come to realize that, okay, we all have a life to live. And then you cannot predict for how long. Despite the fact that you have sickle cell, there are other more serious diseases that people have and they survive. So why can't we? I believe the mindset also have to be. We also need to change the mindset. We're doing what we can. We are doing a lot of sensitization campaigns, but I guess we need to do more, because looking at the awareness ratio, we can say only few are still aware. Only few. If you look at the whole African continent, how many people know about about sickle cell? How many people do screening? How many countries do even have screening machines? In the Gambia, we have only one. On the Gambia, we have only one. It's very difficult, and sometimes you find it very difficult to even do the screening. Some people don't even know. Some people have lost so many kids, not knowing that we are sickle cell warriors. And then as our society is, Bala said it, we get into family marriages. We intermarriage within our families. And if there is a threat, we keep on spreading the disease. So we still need to do more sensitization campaigns. We need to raise awareness. And then we also need to talk more about all the challenges that sickle cell warriors face. it's just hard. Some people just, because of fear, they don't want to talk about it. People like me, I know it's a big challenge, coming out, talking to the world, telling people about your life, telling people about your challenges. Sometimes it's difficult. In real life, find it very difficult. You find it very difficult because if people know that you are a warrior, especially if you are everywhere talking about you as a warrior, you find it very difficult. Sometimes people identify you immediately and then they start talking about you without even knowing that you can live a better life. You can live a healthier life. You can have families. You can have kids. But for the fact that they have already have the mindset that you are a warrior and they don't want to do anything, with you. So they start to discriminate you. It's very hard. Sometimes you find it very difficult. You approach someone and said, I know you are a warrior, you are a sickle cell patient. So I don't think we can match. Not even without them even knowing whether they are carriers or not. So it makes it very difficult. It makes it very, very, very hard. I think that is the reason why men don't want to talk about their health issues. I think that is the reason why it makes it very hard for also men to have cure to their problems, which I believe we have to break. We need to come out, we need to be bold, we need to have coaching sessions. I think these are things that will really help us. So for us to break the barriers and then find the cures and then find the solutions to all our problems. But if these things are not available, then it will be very hard for us for people to even understand us. you know Parents also need to talk to their kids. I know it's the mothers who take care of their families most of the time. Yeah, so male parents also need to talk to their male child, especially if they are warriors. You need to talk to them, explain to them their puberties or the changes that will happen, that will occur in their lives, and then what are the things they need to talk about. They need to get close to their male child and then interact with them and then talk to them. Open up the space so that they will not feel fear. They will always come out and then tell them their issues so that they can help them. But if we change the sets, if we change the sense within our communities or in our families, then it will be very difficult to overcome these challenges. So I believe it's high time that we all speak out. It's high time we create the spaces. It's high time we create the platforms, raise awareness. It's high time we go for mentorship. It's high time we have coaching sessions, at least for us to raise the awareness. And then it's also, I will also appeal to people not to judge people by the way they look. Bella is an example. He's a hematologist. He have achieved a lot. He's married. He had kids. We have a lot of warriors who are here. They have families. Some of them, their kids are only 3. They have only 3 because before they got married, they went for counseling. They did screening and they know that they have matched. It's very hard. Sometimes you might love someone and then at the end of the day you go for screening and then you see that you are not compatible. It's very hard to make decisions. These are things that people avoid, but I think it's high time that we start doing things at least to avoid more challenges in the future. Because if you are a warrior, you fell in love with someone, but for the fact that you don't want to go for screening to see whether you are compatible or not, you don't want to miss that person, you want to spend the rest of your life with that person, but you know that you are a warrior. You have to be very bold. It's a sacrifice, it's very hard, not everybody can do it, but it worth it. This will save you. This will save you financially, it will save you mentally. So because if you do that in the future, when you have kids, you know that you will not have the same burden that you caused your parents. Because if your parents knew that you are going to be a warrior, then they would have made a better decision. We're not saying people should not get married, but at least before you get married, do counseling, do some screening, check whether you are compatible or not. This will really help our societies. It will help us to cope, the number of the spread of sickle cell. Sickle cell is not a death sentence. I always tell people. For us, we said sickle cell is a blessing to us because we know how it feels. We are privileged to talk to the world because this is the reason. This is our purpose. God did not just make us warriors for no reason. Now we've seen the purpose of our life. The reason why we survive the death sentences of 3 years, 4 years, 10 years, and 18 years is because we were meant to educate the world and we're meant to enlighten people about this illness. We have other serious illnesses and people are proud to talk about it. So why can't we talk about it? It's not a curse. You know, this is something that we inherited from our parents. So obviously we should not feel shy. We should feel proud and come out and talk like everybody else. We have other serious diseases in the world. You know, people are suffering from more complicated diseases. I know it's difficult. Sickle cell is very hard because it's unpredictable, you know, but we can definitely manage it. I am someone who manages my sickle cell. When people see me, if I tell them I'm a sickle cell warrior, they wonder how possible that can be. Looking at me physically, people wonder if I'm a sickle cell warrior. At most time, people say, "No, you are not a warrior, you're just pretending." I said, I am SS, you know, which is the worst. But yet still, because I know to manage myself, I listen to my body. If I see anything abnormal, I make sure I report it to my doctors and they advise me on what to do. I don't feel shy to talk about, you know, any changes in my life. And then I discourse and I talk to people. I do a lot of research. I read, you know, just to understand some of the complications and some of the health issues, you know, that are associated with sickle cell. So I would advise all the warriors, be bold. Don't fear, because fear is a problem. It will create more problems. Be bold to talk about your health issues. Be bold to talk to your doctors if you see anything abnormal. Make sure you do the right thing, listen to your bodies, and make sure if you do anything that you think will cause any crisis, just avoid it. Do the do's and don't leave the don'ts. Thank you very much.
Thank you so much, Mr. Aliu Badara, for sharing with us. Certainly a lot to take from that presentation concerning, or from my own experience, the fear and you know, the stigma that comes with coming out in public. I only just came out in public this year, so I do understand there's that fear, and also just growing up. Of course, there's a lot of diseases, but there was never someone to look up to in like with sickle cell and be like, okay, you know, we know famous people who beat cancer, who beat this and that, but we never sort of have someone we can look up to and like, oh, if that guy manages the sickle cell, I too can. Because I think the mental aspect of dealing with sickle cell is that it kind of draws you away from community, from family, from friends, because very few actually understand what you're going through, be it, you know, physical pain or anything like that. So thank you very much. The questions keep coming. We'll have a Q&A section where you'll be answering questions. Keep them coming. So we have some questions in the Q&A and also others coming through the group. So we'll be alternating between the two. So we are getting into our third speaker. Our third speaker is Grajavis Bakatukanda. I hope I got it right. Greg for short. Greg works and studies currently. He's an outgoing person. He loves when people take responsibility of their own actions. Greg started this sickle cell group because he wanted people like himself to have a voice with no stigma attached to it. We deserve to be part of a community despite what we go through, Greg believes. And I see him coming on the video. Grajavis, thank you so much for being here with us, and we're looking forward to hearing what you have to share with us. Whenever you're ready, you can begin. Thank you.
Thank you so much for having me. Am I loud and clear? Or yeah, okay.
Loud and clear.
Okay. Well, Dr. Madu presented the same things that I noted down. So I believe I'm just gonna speak about myself, you know. So yeah, when it comes to growing up, we face different challenges, you know, the stigma issues, you know, and which led me to be playing rugby and jamming. And in the midst of that, it kind of helped me boost my how can I say this, for me to feel like I am me, you understand? And it kind of led me to be individual, you know, to be my own person, which was actually a good thing because after a while, I started playing tennis, I started like just doing every single sports that is known to mankind, you know. I'm not yet married. I'm not married yet. But with what Dr. Madu said in terms of marriage, it is actually a good concern because right now I'm planning on settling down, you know, but I also thinking about like who can I get married to? Like who's gonna be my wife, who's gonna be this, who's gonna be that, you know? So the challenges keep on coming, and I'm keep on wondering like who will be the missus, you know. So far, I haven't gotten one, but yeah. So it can actually lead to most divorces, you know, in terms of marriage, because you might find yourself like you into marriage, like you're loving someone, and then at the end of the story, you find that your partner says that no, you have sickle cell, this and that, we can actually lead to some divorce, and which is actually a little bit unfair for us as males because you truly love the person. You know, you're like you can't live without the person, and for them to just tell you like, no, I cannot continue with this marriage anymore, which is actually hurtful. You know, it is much more hurtful. And with in terms of complications, or yeah, in terms of complication, which can actually lead to lack of self-esteem, you know, because I've been growing up, like to be honest, I've been growing up, which led to me being a little bit which helped I had like a little bit closed in my surroundings. You know, I didn't want to have friends, I didn't want to do this, you know, I was mostly I was probably like one person, I was just like myself, but in my one corner, you know, which led to me being like having like a low self-esteem because when I tell to people like, hey, this is who I am and all that, they'll keep on judging me. They'll be like, no, why are you doing this? Why are you doing that? You know, I've been courageous, you know, to be like, hey, this is who I am. If you don't like it, it's fine. You understand? So that's pretty much it, you know. So yeah, I guess I'm done because Dr. Madu presented everything that I wrote down. So yeah.
Thank you for sharing with us. I'm sure not just me, but a lot of males can relate to what you have said, especially us who are still single and searching and just, you know, having these questions and these doubts and just trying to, you know, make calculated moves because when you have sickle cell, you have to make it calculated. You can't leave the house without your jumper. You can't, you know, those kind of, yeah. So I appreciate you sharing into how it feels like mentally, especially at this age where you're trying to find the next step in your life and concerning family. Also, just thinking of whether your kids are going to also have sickle cell, but if you know all these, there's a lot to consider. So thank you for sharing, and hopefully we get more questions coming in. And then we're gonna go into our next speaker. We'll call upon Cesar to introduce our next speaker.
Okay, thank you, Jean-Pierre. So our next speaker is going to be Jemmy Stefan Anderson. He is a 37-year-old Cameroonian warrior. He is studying data science and he enjoys watching films and listening to music. Stefan, are you with us? Over to you then.
I'm there.
Okay, go ahead.
Okay. I can't put the video. Okay. This is the video. Hello to everyone. like Cesar said, I'm Jamie Stefan from Cameroon, and I understand what all the speakers have said about challenges that we face every day. And for me, I particularly note that our disease is how we manage with strength and how we manage with strength. Sometimes we want to be strength, to be strength, but we do not achieve that goal. And I want to share some experiences that I've faced in work, in my first job interview. So I was well prepared for the interview, and then I passed the first exam for that interview, and then during the oral interview, I was not able to say anything. I was not able to say anything, and reflecting on that fear, I was thinking, maybe I do not feel in good esteem of myself that I can do the work for what I was applying for. And then during my 7 or 8 years of professional experience, I sometimes realize that I'm always I do not have the real capacity of saying no that I should not do it, that I could not do it. I'm always in the research of proving myself or to being accepted for my capacity or for my possibility of, and then culpabilizing about when I'm sick, when I'm not able to work. Well, who will do the work that I've left because I'm sick? And if I were not sick, if and so on. So do not accept that we are not as strong as the others is a real difficult. It could be more acute if I do not have around me people that understand, that people with whom I can really share what I feel inside. Like one of my predecessors said, it is really important for us to share the emotional event that appear in us. And for many years, I always, even if I could not succeed now, I always talk with people around me about that hunger that grow in me in front of that difficulties, or that in front of that contrarieties in work, about emotional affection that I have about one girl or another's, and sharing that emotional how do I say, showing that emotional sensation that I have inside in me, help me to really to really appreciate, to really distinguish, what guides my action. Even though if I do not, even though if I do not do the right thing, but I have the help to discern about this is fear, this is hunger, this is I don't know, this is I don't know how to express it, but I always have a guide in my action to help me to do the best choice, even though if I am taking the wrong way. And another proof of how do I say, another proof of low esteem that I see in me, maybe because of the sickness, is some years ago I was a student. And then I was doing an internship in a hospital, and I met her, a girl who was very beautiful, and I would have liked to be with her. And during our discussion, I realized that the first thing that I put in front of our discussion is my sickness. Am I as pretty as you want? Should I be accepted by you? And on reflecting on that different sensation or different emotion that have linked with low esteem of me, I met a friend who is nurse in palliative care, and I share with him my desire to see a psychologist, even though now I've never seen that psychologist, because I've never went to the hospital to see to take a rendezvous and to see the doctor that have been recommended to me. Even though I did not do that, I think about it, and with his counsel, we arrived to the conclusion that it is really important for me to, also because during my experiences of work, I was constantly sick. So the pain and the severity of the disease leads me to a lowest esteem of myself. Now I'm trying to get to regain that esteem by reading books on psychological ed that could help me to accept myself like I am, and accept the limit that I have, accept all the things that I could not do, and also the help of God in my daily life. So as a Catholic, I have assistance of many people that are around me to help me to help me manage all the circumstances of my life, between work, between family, between health, between friends, and things like that. And with that limitation, I note that during the other speakers that sometimes we always have the idea that people do not understand me. But I think for the other sickness people that I've seen, few are those who open the doors for being understood. So I have a particularity that I have a lot of friends that I on which I could count. I will say it like that, and that understand me, that helped me to going on, even though sometimes I don't want to to how do we say in English, to déranger. I don't want to always saying that I'm sick. Sometimes I am sick. I'm saying nothing, but this is very recent attitude, because sometimes with age we do not want to alert everyone if you are sick. But during the past years, I do not have how do I say, I do not have difficulties to say to my friends and to my relatives that I'm sick, and I'm pleased to see her with me. I'm pleased to say some jokes that that maybe I will die tomorrow or some things like that. But that relative helps me to share how all the difficulties, that all the emotional difficulties that I passed on. Thank you.
Thank you very much, Stefan, for that. What I noted from your presentation is that you are quite self-aware of your strengths and your limitations, and you know how to help you, or you're learning how to help yourself mentally and emotionally, and to gain acceptance of your circumstances, what you can change and what you can't, which is very useful. It helps a lot when we are dealing with sickle cell. And I like that you have friends to lean on for support, which we all do. I especially enjoyed a bit of your dark jokes, which I know sickle cell warriors, we all do. We all have, like, we just said a joke about dying early. A bit dark, but I understand. Yeah, I also make such jokes sometimes to cope with my circumstances, which many of my healthy friends will not understand. But anyway, so thank you very much for that, Stefan. So we are now going to move on to Peter Osikoya. He is a warrior and advocate from Nigeria. Peter is a proficient project coordinator for W Rescue and Adopt a Warrior, and serves as the community coordinator at Sickle Cell Advocacy and Management Initiative. He also has certification in genetic counseling and in digital marketing. He has established an impactful online support platform called Sickle Cell Matters, and he can be found on various social media platforms under the handle at I am Peter Osikoya. Peter, if you're with us, please go ahead.
Good evening, everybody. Thank you for the invites, and I want to appreciate all the amazing speakers that have spoken earlier. I think I will just go right on to management and how best to live as a person living with sickle cell. So I'm based in Lagos, Nigeria, and over time I've seen that a lot of things haven't been said about mental health and sickle cell. And going through some of the questions written. I'll just go right into major things, starting from parents, then to men themselves. One of the things I usually advise parents who find out that the child lives with sickle cell, especially boys, is to first go for genetic counseling. Now, at the genetic counseling level, they get to understand what happens to children with sickle cell. What are those peculiarities you need to pay attention to? What are those things that you need to discuss with your doctor? So with genetic counseling, they get unbiased information about sickle cell in general and also pertaining to men's health. Two, I try to advise parents to focus on nutrition. Nutrition is one of the key things when it comes to managing sickle cell. Now, without nutrition, you tend not to have the health you desire. Nutrition is, people see nutrition as something that is so expensive. No, nutrition is those little things that you take cognizance of, that you take into your body, right? Because your body determines your physical outlook, your body determines your um, physical representation. So taking cognizance of what you take in helps to a very large extent, maintain a good health level. What are those nutrition patterns that we need to consider? Taking a high level of proteinous foods, which include fish, turkey, chicken, and a whole lot of things. Reducing our carbohydrate intake. This helps to a very large extent reduce so many things that happens with our health, including vegetables in our meals. Including vegetables are broad. We have spinach, we have a whole lot of vegetables, depending on what country you find yourselves. Including this in your diet helps to improve your health. One of the other major things is water. Now, as we all know, sickle cell is affected in the red blood cells, and this is in reduction of oxygen in the red blood cells. Now, water to a very large extent oxygenates the blood. Now, this in turn reduces the excessiveness of sickling in the red blood cells. So, with constant hydration, it helps your body maintain a proper level of blood flow, and it helps your body to be at a certain pace which is not higher or lesser than how it should be. Three, I try to encourage parents to go for regular hospital visits and blood investigations. You don't self-diagnose your child. You don't self-diagnose anybody that has sickle cell, especially children, because the symptoms usually look similar. Going to the hospital to see the right doctor. For children, you're seeing a pediatrician or a pediatric hematologist. It helps you to understand what exactly is wrong per time and what treatment needs to be carried out. Also, for adults who live with sickle cell, I advise that you don't miss your clinic dates, because I found out that in my line of work that people don't usually want to visit the hospital because, oh, I'm fine during this period, and they see it as not necessary. Since I'm fine, what am I going to discuss with the doctor? Seeing your doctor basically does not mean you're not feeling fine. Your doctor wants to also evaluate you when you are in good condition, to be able to know, oh, how well are you doing in this your condition at this stage, so that it helps them to understand what could go wrong should, in case you come in weeks later and you're having a very severe crisis. It helps them to significantly pinpoint what could have happened rather than going through a whole lot of process trying to understand it. Also, paying attention to yourself as an adult that lives with sickle cell. paying attention to yourself. What are your triggers? What are those things that you do that affects your health negatively? You need to reduce them. Most times we can't actually stop those of our experiences, but we can reduce them if we are able to pinpoint, oh, stress is my problem. How do I reduce my stress? What do I do that causes my stress? Overthinking is what causes my problem. How do I do that? Or emotional stress is what causes my problem. Psychological stress. What are those things that leads me to have all these levels of things? Now, understanding yourself, because when you pay attention to yourself as a person living with sickle cell, especially as a man, it helps you to know, what do I need to do to improve myself? So pinpointing things that relates to you helps you better. 4, understanding your health aside from what the doctor has told you. Now, your doctor helps you to understand how your health is, but you understanding your health for yourself can help you to advocate well for your health. Because one of the things I found out in my line of work is people don't tend to understand their health and what is happening with their health.
Peter, are you still there? Peter, just give him a few seconds. I think he's being kicked off the call. I'll just, in the meantime, while we wait for him, he got just a couple of minutes to wrap up. But in the meantime, I'll just go through some of the pointers that I've picked up from this webinar to do with mental health. Okay, I think Peter is back. Let me see. Oh, I've been kicked off. Have I been kicked off? Okay, no, I'm here. Peter, are you back?
Yes, sorry, I had a glitch in my network.
Okay, just have a minute or two remaining. If you can wrap up, please. Thank you.
All right, that's fine. So when you understand your health, it helps you to live right with your health. So with complications that are relating to sickle cell, they've mentioned quite a few. For me, priapism can come at any age, based on a question that somebody asked. Priapism can come at any age, and one of the best ways to help your child understand what it is by explaining to them what sickle cell is and how it happens. That way, they're able to be in the know. And parents should not see it as a way of that a child is doing something wrong. No, but getting help for them. Now, if you're able to help your child understand what this is, they are willing to engage you when they have problems like that. And they're willing to always engage their doctors to help them know, okay, what do we do going forward? So for me, as a man living with sickle cell, one of the major things you need to do is to first accept that you live with sickle cell, engage your doctors, get more knowledge about your health, know what your triggers are, try to reduce them, and try to be good on your diet and be well hydrated. With that, you're good to go. Then also try to get support. Don't hide your health status. Engage people. Try to engage, have support, create a support system for yourself that can help you through your trying times and help you to keep yourself updated when it comes to emotional support, mental support, and physical support. Thank you.
Thank you very much, Peter. That was very informative. You really did talk on a lot of points. Thank you very much to all our speakers. So I'm just going to quickly summarize what has been talked about and what I've picked up on this. Then we'll go into our question and answer session where our speakers and our doctor will answer our questions. Because we are running out of time, we'll keep the questions down to about 5 or 6, if we can manage that. So what I've come up with is that the first thing is parents are the ones who usually help children or dictate how children and adults are going to manage their sickle cell. Parents must do their research and explain to their children what sickle cell is, and be a safe space, especially for young boys, to approach them for help. Someone that asked what priapism is, it's the painful, long-lasting erections that come, and they can come at any age. And boys must be spoken to about this and be told that it happens to boys with sickle cell, and they should approach their parents and healthcare givers or providers to help them treat this. Help your young boys and the men pinpoint the sickle cell crisis triggers. Once you can pinpoint these triggers, you can manage your sickle cell quite well. Nutrition is very important in managing sickle cell. It is one of the most accessible forms of managing sickle cell. And then adults with sickle cell and children, don't miss your medical appointments, even when you're well. It makes it easier for the doctors to know what your numbers are when you're healthy, for them to know what's wrong with you when you're sick. I know we all have a tendency when we think we are well that we do not need to see the doctors, but we do need those. We do need to know what our numbers are when we are healthy. We need to know what our targets are to keep our health managed. I've seen that there are lots of restrictions in being a man when it comes to sexual health, with intimacy, choosing a partner. With intimacy, it has to be planned around your sickle cell crises, how well you're feeling. Sexual activity can be restricted by pain or complications by sickle cell, like let's say a vascular necrosis. There's lack of information when it comes to sickle cell, and this makes it hard to manage. There's also lack of safe spaces. Sorry, I need to apologize. My cat's in the background and I'm struggling to get rid of her. But there's lack of safe spaces for men to get support and to talk about how sickle cell is affecting them. Many men have talked about the loss of control, especially when there's increased dependency when they're in crisis, and how that can affect their masculinity and their self-esteem. Sickle cell brings in a lot of mental health issues that are not being addressed well. When it comes to being in a relationship, the disclosure of having this illness can be the make or break point in the relationship, as many people don't understand what sickle cell is, or there's the high stigma around it. And there's also financial restraints that come from managing an illness when men are expected to be the providers. And this can also affect their mental health and their health in general. So now we are going to turn it to the question and answer part of this webinar. So the first question that we're going to ask, I think this will be for the doctor. Doctor, does hydrea affect male fertility? And do men have to take it, or do they have to stop taking it while trying to conceive as women do?
Thank you, that question. Now, looking at as when I was speaking, hydroxyurea is currently drug that is most readily available when it comes to the management of sickle cell. We have some other alternatives that are in existence, but they are very expensive and not readily available. So what has been found in studies is that it is associated with reduced sperm count. So, but it's not necessarily causing somebody to be infertile. The condition is what may cause somebody to have challenges when it comes to the fertility. As I said, if there's blockage of blood vessels causing recurrent hypoxia of the organs themselves, which is the testes, so the estrogen that will be produced, spermatogenesis will all be affected. So this is one of the key issues with regards to infertility in men. But weighing at the benefit with regards to the taking the medication and not taking the medication, I would advise for people to take the medication. That will protect you from all the complications that are associated with the disease. Now, there are different opinions. If somebody is stable with the medication and now they are trying to have kids, it is something that is reversible. If you stop the medication for some times, it will, the sperm count will go back to normal. But then that means the disease is controlled and you are not having any complication. So in that sense, for the sake of trying to improve your chances of getting children, we will advise for you to stop it as long as you are stable. But if you are not stable, we would advise you to continue with the medications. Thank you. I hope that answered the questions.
Thank you very much, Doctor. So yes, we do have to continue taking our medicine for us to keep up our fertility, I suppose, even as women. Thank you for that, Doctor. Then the next question that we do have is, let's see, what coping mechanisms would you recommend to your male counterparts with sickle cell, to the young and the old? This is for any speaker. Maybe I could ask my co-moderator, Jean-Pierre. Do you have any coping mechanisms you could share with others?
I think one of the speakers did mention music or creativity. For myself, it's been poetry and writing, and anything that helps me to be creative has been a good coping mechanism. It's like an entry into a different world, which is not limited by what I'm going through. So I feel like being creative has helped as far as dealing with sickle cell, for me personally. Yes. I don't know if any other speakers would like to tackle the question.
All right.
Ali, would you like to also share your coping mechanisms? Ali, I see your hand up. Would you like to share your coping mechanisms?
Yes, I was trying to unmute. I was waiting for the moderators to unmute me. Am I clear?
Yes, we can hear you.
Yes, I just had something that that I wrote from what I was given. I think I just wanted to share this and then give the coping mechanism. Most of the challenges that we face as young and growing men, warriors, fear of getting exposed, and then fear of being laughed at, fear of being discriminated, fear of being rejected, and fear of losing people that we love. And then we are always seeking for approval. We are always looking for approval from people. These are some of the challenges that we have. And then the coping mechanism or the solutions to all this is to know more about yourselves, know more about your disease. You need to know more about your disease so that you will be able to talk about it and you will be able to know yourself better, because you can tell yourself better than anybody else. And if that is done, then you'll be ready to accept rejection. You also need to be ready. When you know yourself, you'll build up your self-esteem, because when you know yourself better, you'll be able to talk about yourself. You build up your self-esteem, and then be ready to accept rejections. As warriors, we have to live with that. Always have to be ready to accept rejections and move ahead, because it's difficult. We have a health condition, a lifelong health condition, which others will accept and others will not accept. So as warriors, we always have to be ready to accept rejections and have the courage to move on, because that is how life has been made for us. And also never to stop trying. I am somebody who never quits. I don't believe in quitting. Anything that I want to do, I just keep on doing it. Unless if I know that, yes, I've tried so much and I can't do it anymore, or my system does not allow it, then that is when I stop doing it. But I never quit. In anything that I want to do, I just keep on doing it. I've been repeated twice during my educational periods. I've repeated twice, but it does not discourages me, because I know the reasons why I used to be absent is because of having prizes all the time. So it does not mean quit. I keep on moving and keep on trying. So I never quit. I am someone who does not quit, and I will advise all warriors: don't quit. We are not failures. We are faced with obstacles, but never quit. Keep on trying, and then go for coaching sessions. This has helped me a lot. In the past 8 months, I had the opportunity to attend an 8 weeks coaching session, which was given to me during my social media campaign. I had the opportunity to be given 8 weeks coaching session, which I took, and then this thing has helped me improve a lot in my life. It has changed a lot in my life, because it has built up my self-esteem, given me confidence, made me to stop procrastinating, because we are always procrastinating, for the fact that we don't want to try because we fear. Like I said, we have this fear in us that keeps stopping us from doing the things that we like. So the coaching session did help me on so many things that have helped me improve on myself, improve on my self-esteem, do the impossible, always implement on my dreams, not just think of it and then procrastinate and then give up. This thing has also helped me a lot. And yes, so basically these are the things that we need to do. We also need to take risks when it's necessary. Stefan just said, you wanted to see a psychologist, but you end up not going, and then I am someone who is very bold, who talks about my condition everywhere. I don't fear anybody, because I feel I have to tell you, you have to love me for who I am, not what I am. If I am a warrior and I love you and you know that I love you sincerely, if we are compatible, because we need to do a test. No matter how much I love you, I also need to protect my future and my partner's future, because we don't want to bring in kids who will also face the same challenges that I faced as a child. So obviously, these are the things, these are the advice I will give to any warrior. Be courageous, be bold, develop yourself, go for coaching sessions, and then find time to accept rejections. It's normal. I don't think it's a big thing. People get rejected for so many times. I looked up to Bill Gates. I looked up to Mark Zuckerberg. These are people who have been rejected so many times. So if
Sorry,
this is
Sorry, Ali, I need to cut into your answer. We are running time and we need to answer the other questions. Thank you. Thank you so much.
Sorry about that. Thank you so much.
Thank you. Okay, our next question is a bit different, but someone has asked, what is a positive of living with sickle cell? What in your life has been positive because you are a warrior? I think, can I ask Peter? Peter, what in your life has been positive because of sickle cell?
Okay, for me, positive is it made me conscious of my health, and it made me become an advocate for my health. It has made me stand out in everything I do. it's for me, sickle cell has made me be excellent in anything I do, in the sense that I try to be my best at anything I do, wherever I find myself. Now, this occurs only because I try to be positive about everything. And positive is not about finding happiness outside, it's from understanding yourself, finding happiness from within. That way, you are able to live the positive life that you want, and you're able to achieve anything that you want. Any goal you set yourself, I set myself out to do, I achieve it. This is all because I have made the point of duty to accept who I am and live my best life with it. So being positive really most times comes from within. And for me, that's it.
Thank you very much. That is wonderful. I do like that, being happy and being positive. People have asked me, why am I so happy? And it's because I'm alive. I love life because I'm alive. I'm here. So yeah, graduates, do you want to add to that? What makes your life positive because of sickle cell?
No, nothing much, nothing. I was just about to say the same thing as people, as the other presenter also just said.
Okay, thank you. So our next question is, sorry, are any of our presenters married or in a relationship? Just please put up your hand, because we have another question here that says, for the men that are married, how have you managed to communicate your challenges to your partners, and what advice would you give those of us that are struggling to share and be open? Is anyone here in a long-term relationship or been in a long-term relationship?
Okay.
Okay.
Well, I don't think it really has to do with being a relationship, right? It's basically about working on yourself. When you're able to work on yourself, you're able to communicate better. Communication is not about meeting the person first. It's about how do I express myself. You're able to express yourself as a person. You are able to communicate to your wife. You're able to communicate to your children, right? It's because we find that we put our health first before any other thing. No, you are first human, right? When you see yourself as a human being, being able to interact with another person, that way communication is easier. So it's about building yourself, understanding your self-esteem and building it right. That way you're able to handle anything that comes your way, whether be it family, be it relationship, be it anything that you find yourself in. Like the speaker that said he puts his health first. Yes, those are his concerns. But if he sees himself as first, this is me as a person, I'm meeting you as a person, let's first discuss major things, then I can chip in my health later. And based on our interaction, I know if I should let you know or not. So it's more about building your own communication level for me.
Okay, thank you very much for that. Thank you. Anyone else? Does anyone else have something to share? And then there's another question about fatherhood here. If anyone is a father, how has sickle cell affected your role as a father? We can also throw this question to the audience. You can answer the question in the comment section if any of you are fathers, and tell us how having sickle cell has affected your role as a father, positively and negatively, please. Okay, another one is, what do you wish could be openly discussed in the sickle cell community to make life living with sickle cell as a man or boy easier? Who haven't we heard from? Doctor? I'm not sure if he's still here.
Yeah, I guess I responded to that question.
Yes,
And
okay.
said that basically what needs to be discussed more are the complications or life challenges of men Being more open about it helps the other person become better at how best to engage certain things that comes their way. So being open or telling your story, telling your own story as it is, helps the other person to learn and become more observant.
Thank you. So another one is, I think this is for doctor as well. What is the best management therapy for avascular necrosis before one can raise money for surgery?
Okay, so in the meantime, before you respond, I think for me, for us in Nigeria, when I find out that people have AVN, I tell them that the basic management you need to have is reduce things that put stress on your leg, right? Excessive walking, too much standing, anything that puts stress on your leg is what you should reduce. And again, fear of the mind, putting emotional stress on yourself affects your health generally. A lot of people, because they've been told I have AVN, they've put the solution of surgery on them. They are more focused on the surgery rather than keeping themselves in good health. So for me, I advise reduce everything that puts stress on your health, which in turn, to a very large extent, you're able to manage your health before you do the surgery. I've had people who had AVN for 10, 15 years before they even did surgery. So it's much more about understanding the do's and don'ts of AVN and try to manage it as you can rather than putting your emotions first.
Thank you for that. I think I know I'm not a man, but I'll just share my story here because I've been dealing with avascular necrosis since I was 16 and I'm now 34. I've had avascular necrosis of my hip and avascular necrosis of my shoulder, and I had my hip done, but I had lived with it for 10 years. And what worked for me was physiotherapy. That worked a lot to strengthen my hip, and now I'm doing it to strengthen my arm because they will not operate on my shoulder until I'm over the age of 40, and it's been hurting since I was 27. I'm 34 now. Physiotherapy has helped a lot. Strengthening the muscles that support the bone has helped a lot. It's helped with the how my bones move. And the other one was working on my diet. I had to eat food that increased my hemoglobin levels for me to make sure that I did not go into crisis often before the surgery, and to make sure that I did not go into crisis after surgery as well. My HB levels used to be below 8 or maybe below 9, and I had to get them above 10 for a few months for them to do my surgery. So I would recommend physiotherapy and changing your diet, and also having good mental health can also help a lot with it. Okay, so now another question will be, let me see. Okay, so I think maybe this will be the last one, or we'll have one more. We'll see.
Sorry,
But what advice?
Dr. Bella has his hand up.
Oh, okay, let's see. Okay, doctor, please go on. You just have to unmute yourself.
Hello.
Hello, doctor, we can hear you now.
Oh, thank you. I kind of lost power here, so apologies.
That's
Yes,
okay.
I think I agree with both of you, what you've said with regards to the vascular necrosis. So one of them is before treatment, and even after treatment, you just have to reduce the stress on the hip, because usually that is what caused it. There is blockage of those blood vessels. And the bone is one of the tissues that always, you can regain all the things that are lost, but provided that the blood supply doesn't get compromised again, you could regain all that bone. So reducing the stress on that hip will really help. Unless it is damaged beyond repair, that is when you need the surgery part of it. And as you said, the dietary changes also to keep up your hemoglobin would also help. And also hydroxyurea is one thing I found that in Africa, we kind of the use of it is not very widespread, but many research done in different parts of the world have shown the efficacy with regards to it. As long as one is not stable, we would recommend for him to continue taking it as long as the side effects are not disturbing the individual. All right, thank you. That's just what I wanted to add.
Thank you, Doctor. Okay, I think we are going to have one more question because it's nearly 9 o'clock now on this side. Doctors, your hand's up again. Do you have another point? Okay. How does sickle cell affect your careers and the societal expectations of being breadwinners? If any of you are the breadwinners in your family, or if you have a long-term career, how has sickle cell affected it? How do you manage it? Stepan, would you like to answer that question? Yes, go ahead. Just have to unmute yourself. Okay, go ahead, Stepan.
I plan to be a researcher in my life, but now I don't know. I don't know if I will achieve that goal, because now I'm studying data science, because I'm no more able to work in the lab for a long term because of cold, because of tiredness, because of many things. And I'm changing, I'm reconverting, I'm learning a new job because of that health condition that are not very I don't know how to say it. I do not have now well conditioned to continue to work in the lab as lab technician. But in 2012, for example, I have to stop studying for 3 or 4 years. I was in level 4 in animal biology, and I was in my way to a PhD. And then I had to stop studying because of illnesses. And from 2010 that I finished with school, bachelor in medical analysis, I found work for 4 or 5 years without seeing anything, and I've decided to go back to school. In 2015, I started work, but during all the years that I've worked, I felt sick every time, even 2 or 3 times per year. And I lost the dream of continuing working in a lab, so that I'm now like Aliu Badara said, I try to move on to another field of work, like data scientist or biostatistician. Maybe with my background in animal biology and new background in statistics, maybe I will find myself in a lab as a researcher in another way. I don't know, but comparatively to my classmates that have already achieved their studies, how do I say? I'm late. That's how I can say illness have modified my yes. That's all.
Okay, thank you, Stefan. So you had to change your career direction or your tangent to what you could manage. That's
Yes.
what I got from that.
Yes.
Okay. Okay, thank you for that, Stefan. I'm just going to skip Ali and Graduates right now. I'm going to ask Ruth, who's one of our in the audience, for her, I think, answer or question quickly. Yes, Ruth, please unmute yourself. We have just a few minutes left.
Yes, good evening, good afternoon, everyone. I'm happy to be here. Of course, I am a warrior, but I'm an adult. But I want to try and answer the question of if you were bred association. We have so many adults in their 50s, 60s, and late 40s.
Sorry, Ruth, you're breaking up.
I have seen many of them, and they've led a normal life. The fact that this, and I think we lost our breaking. Sorry, actually, one of our vice chairperson, he's 59 now. He's a married man. He's a continental chef, and he works in a big Indian hotel, and he has a family of 5. I think himself and the wife plus.
Sorry, Ruth, we keep losing you here.
3 children. That
Sorry, we've lost Ruth there. Okay, I'll just take one more from our President Graduates. Graduates, do you have something to say? We just have a minute or so left.
Okay.
Sorry, just unmute yourself there.
My apologies about that.
I'm meeting is yes, I have unmuted now.
Sorry, Ruth, we can't hear you. So Graduates is now answering the question.
You hear me now?
No, we can't. Graduates, please carry on.
Okay.
Well, I had 2 jobs, and I'm currently studying. I got a part-time job as well as like a full-time job. So how do I manage that? It's just the way I just built it. I'm just outgoing, and I love adventures. I love everything that I don't want to keep myself indoors. So I gotta be busy with life, like having 2 jobs, and I'm also studying. So I'm kind of like that person that is more outgoing and loves everything.
Thank you very much for that. I'm sorry, Aliu, I can't take your answer. Maybe if you keep it quite short, I would like to wrap up now. So we'll take your answers last.
Yes, thank you very much, Isaiah. I just wanted to say, yes, being a warrior have really changed my career path, but we never quit. I wanted to become a scientist,
Sorry, you're breaking up
biology.
there.
I said, are you getting me now? Am I clear? Hello? Hello?
Yeah.
Hello?
Yeah, we can.
Am I clear?
Yes,
Okay.
you can hear me clear?
Yes, okay. I just wanted to say that, yes, being a warrior have changed my career path. But yes, here I am also dealing, because actually initially I wanted to become a biologist or a doctor, something like that, but I have to quit because of lack of confidence, and then with the stigma and then the misconception. But here I am dealing with sick patients now. So I guess if you are a young one and then you have an aspiration to become something, I would just advise you not to give up, keep trying, because it's all possible. We have the likes like Dr. Bella and the others. So if they can do it, then why not you?
Thank you very much, Aliu. So you heard it from our men tonight. This was a very interesting and informative webinar. Thank you so much, Dr. Bella, Aliu, Graduate, Stefan, Peter. Thank you so much to my co-moderator, Jean-Pierre. And thank you all for joining us. Thank you for those questions. This was such a great webinar. Jean-Pierre, is there anything else you'd like to add? Is he here?
I'm here. Can you hear me?
Yes, I can hear you.
Just grateful for every person who shared their story with us today, especially from women's perspective, things that I've experienced and I know other warriors have as well. And the knowledge will definitely have a great impact going forward, and hopefully we can pass it to the next generation on how to handle a lot of these mental issues that originally I felt like I was the only one going through, but with such a platform and community, I'm able to know that I'm not alone, and the struggles that I go through, I can find a community like this to share. And as they say, iron sharpens iron, and definitely we've been sharpened tonight. So thank you to everyone, and yes, until next time.
Thank you, Jean-Pierre. I think I just had one more thing to add on. What I've gotten from this webinar is sickle cell is such a lonely journey. I think it would be good for us to set a safe space for everyone and mentor the next generation. And hopefully sickle cell can be more bearable for everyone. Thank you so much, everyone. Thank you for joining us. Till next time, good night.
You too. Bye.
Bye. Good night, everyone.